So good afternoon, everyone. On behalf of Councilmember Navarro and myself, we want to welcome you to the Human Services and Community Safety Committee meeting. Paul, are we good to go?
Yes, we are, Councilmember Garland.
All right, thank you. Due to concerns over exposure to coronavirus, the city has implemented measures to protect our community, including the closing of council chambers and limiting public attendance to electronic means only. Members of the public may attend the meeting virtually through Cisco WebEx events or view the meeting recording by visiting the www.tempe.government.gov/clerk for more information. And it's important to understand that no formal votes or decisions about city programs, policies, or budgets will happen here. Our role is to explore various topics with staff and stakeholders and community members and to make recommendations to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be a part of whenever you choose to be. And you can share your thoughts with us by filling out a comment card about any item on the meeting agenda or by reaching out to us directly with any other thoughts, questions, or ideas. We need you to fill out a comment card in advance that can be read into the record for an agendized item. The link to the comment cards can be found on our committee webpage at www.tempe.gov/HSCS. And you will also find contact information for committee members and staff there for non-agendized items as questions. So I'd like to call this meeting to order on May 27th, 2022. So we will get to, that's our first agenda item. We'll get to the second agenda item, which is a reviewing of our minutes. I'd like to make a motion to approve the minutes from the May 27th, 2022 meeting. Councilmember Navarro.
So approved.
All right, great. That's always so easy to do. Thank you very much. The committee welcomes public comment, as we said. According to the Arizona Open Meeting Law, the committee may only discuss matters listed on the agenda. Matters brought up by the public under public appearances that are not listed on the agenda cannot be discussed by the committee. A 3-minute per person limit will be in effect. So, Paul, do we have comment cards? It's a big question.
Yes, we do, Councilmember. We have 9 members of the public that said they'd be present to give comment on this meeting. And we're going to start with Sharon Doyle.
Thank you.
And it looks like Sharon is not with us on this call. So we're going to move on to the next person.
Okay.
Ana Igas Gomez. Moving on, doesn't seem like be on the call. Next person is Haley Hodges. Looks like Haley's not joining us. Moving on to Brian Hummel. Brian, I'm going to unmute you and please give your comment.
Hello, thank you. My name is Brian Hummel. I'm the Arizona Director of Government Relations for the American Cancer Society Cancer Action Network. And I'm calling in to speak about the flavored tobacco issue that's on the agenda later on. It's important that the city of Tempe addresses this issue as a public health issue. As such, we would ask that you, as you address this policy, that you deal with flavored tobacco, all flavors, all products, and that you institute a strong enforcement mechanism. These are all standard pieces of a strong public health approach to this issue. We know that menthol is a key part of the tobacco industry's strategy to bait youth and communities of color into a potential lifetime of addiction. Tobacco remains the #1 cause of preventable disease, disability, and death in the United States. and smoking increases the risk of at least 13 different types of cancer. So we would urge you, as you address this issue, that you look at it solely through a public health lens and ensure that we protect all citizens of Tempe from these dangerous products. Thank you.
Thank you, Brian.
We're going to move on to the next member of the public who wants to present in person. I see several unidentified callers, so I'm going to call out this name and see if this person is available. Alexandria Routier. If you want to raise your hand, let me know that you're there. Okay, I don't see her in our participant list, so moving on to the next person, Greg Taylor. Okay, moving on to Paul Ulam. Okay, moving on to Joseph Uhas. All right, council members, those are all the members of the public that said that they wanted to present comment at this virtual meeting. I'm going to read the following members of the public who instructed us to read their comments into the record, starting with Sarah Amaral. Her comment is, I work for the American Lung Association as the development director. I'm a Tempe resident and support removing all flavored tobacco products from the market in order to protect our next generation of youth. That's the end of comment. Next comment is from Lori Bastian. As a 20-year resident of South Tempe and a mother of 3, I urge the city of Tempe to be the first city in Arizona to ban the sale of flavored tobacco and e-cigarette products. Flavored vaping products entice our children to start using tobacco, leading thousands of our kids to nicotine addiction. Please ban all flavored nicotine products in Tempe. To help regulate this ban, I also ask that Tempe require all retailers to be licensed by the city in order to sell tobacco products. Let's protect our kids and help them avoid nicotine addiction. Next commenter is Nikki Blasi. Comment is, it's no accident that tobacco companies flooded the market with fruit, mint, and candy flavored products. These flavors are used to entice kids, communities of color, and the LGBTQ plus community into lifelong nicotine addiction, and that's exactly what happened. Now over 30% of high school students use tobacco. Tempe kids and families deserve a policy that protects us from all flavored tobacco products. Next commenter is Philip Carpenter. Tempe, most fortunately now, has the opportunity to be a tobacco control leader by truly making a difference for our youth by enacting a flavored tobacco ban. Tempe can follow what San Diego did recently by enacting a strong and effective ordinance that will end the sale of all flavored tobacco and e-cigarette products with no exceptions. As council members, you are certainly aware of the hooks that big tobacco and big vape use to lure youth to their products. It's flavoring, especially menthol, that is used to make their harmful products easier to use but harder to quit. The effect is the same as their pleasure receptors soon become addicted and they've got a lifelong customer. Tempe has a unique opportunity to advance health equity and save lives. It's time to step up and again be a tobacco control leader in Arizona. Next commenter is Jessica Flitcroft. As a respiratory therapist working in the community here among the adult and pediatric population, I see an alarming amount of people who are utilizing flavored tobaccos, whether it be combustible cigarettes or e-cigarettes. Unfortunately, there's misrepresentation on how much tobacco is in these products by the disguised flavors and leads to addiction to long-term lung damage for youth and adults. Please consider any legislation that would limit access or ban flavored products that mislead members of our community and put them at a great risk for lung disease and long-term effects of nicotine. Next commenter is Lynn Gerald. My name is Dr. Lynn Gerald. I am a professor of public health and a scientist in the Asthma and Airway Disease Research Center at the University of Arizona. I am also a member of the American Lung Association's local leadership board. As a respiratory scientist, I have seen what tobacco can do to the lungs, and I do not want children to be targeted by the tobacco industry. I strongly support removing all flavored tobacco products from the market. Flavored tobacco products attract youth and lead them to a lifetime of tobacco addiction. I urge the committee to take bold action to protect our kids from tobacco addiction and the health problems resulting from this addiction. Next commenter is Will Humble. Thank you for proposing this evidence-based best practice that has been proven when implemented effectively to reduce youth addiction to nicotine. The Arizona Public Health Association provides our full throat-in support for this measure. Thank you for using evidence to drive City of Tempe public policy. Next commenter is Stacy Johnson. I applaud Tempe for bringing forward this policy. Action on flavored tobacco and a tobacco retail license is needed now to protect the community and address the urgent issue of youth tobacco use. Every day we delay, Big Tobacco will continue using their flavored products to addict more lifelong customers. We need Tempe elected officials to put the health of our community over tobacco profits and pass this policy. My kids are teens, soon to be enrolled at ASU. Tempe's leadership can impact real change. Next commenter is Brandy Jordan. As a parent, physical education teacher, and coach, I am greatly concerned about the youth in our communities. Kids as young as 6th grade openly share about their use of flavored nicotine. Vaping is viewed by kids as being cool. Kids said they can very easily purchase these products, and sadly, kids believe vaping is safe. I urge the council to enact the strongest and broadest ordinance that will end the sale of all flavored tobacco and e-cigarettes products with no exceptions. Tobacco products should be impossible for kids to buy from retailers. To start with, retailers should be required to obtain a license to sell tobacco. Next commenter is Catherine Kenney. I am the board president of the Phoenix American Heart Association, also a registered nurse and nurse practitioner. I have personally witnessed the suffering and life-ending impact tobacco and tobacco products have on children and later as adults. I applaud Tempe for bringing this policy forward that will save lives for years to come. We need Tempe elected officials to put the health of our community over tobacco profits and pass this policy. Next commenter is Sandy Lowe. My name is Sandy Lowe, and I'm a lifelong Tempe community member, public education advocate, as well as a past school board member for Tempe Union. I am writing because it is extremely concerning that many of our kids are becoming addicted to flavored tobacco products. There are far too many stories of our kids' addiction to these products and the serious health problems they are facing because of this. These flavored tobacco products are so inviting, and these teens have no idea what they're going to face if they become addicted. Please pass this ordinance to end the sale of all flavored tobacco and e-cigarette products with no exceptions that target kids. Tobacco retailers must be required to obtain a license, which will allow officials to determine which stores are selling tobacco products. There has to be a strict adherence to this law. Kids today are faced with so many decisions, many of which threaten their well-being. Please remove this dangerous temptation and help families keep their children safe and healthy. Megan Lucero. Please remove flavored e-cigarettes from all store shelves in Tempe. Let's make it hard for our youth to get their hands on these dangerous items. Let's make it more difficult for adults to purchase these items easily and redistribute to kids. This is a dangerous item with health and emotional consequences, and kids don't realize how easily they can get hooked, especially when it tastes like candy. I've seen firsthand how these vapes are to get, and since they taste and smell good, it doesn't register as something bad to our children. It seems like expensive candy. For our overall safety and health within the community, please ban all flavored e-cigarettes from being sold within our community stores. Brianna Miller. Mayor Woods and Tempe City Council members. My name is Brianna Miller, and I'm representing Children's Action Alliance. Children's Action Alliance works directly with communities most impacted by pervasive health inequities to develop policy solutions to pressing issues in Arizona. Our goal is to realize an Arizona where all children can thrive. As an organization concerned with the health and well-being of children in Arizona, CAA supports a comprehensive ban on the sale of flavored tobacco products, including menthol cigarettes and other menthol flavored tobacco products, and city ordinances allowing for robust enforcement and regulation of such a ban. Tobacco companies are formidable public health opponents, prioritizing profit over the health and safety of everyday people. Flavors get kids hooked. Data shows that 80% of kids who have used tobacco started with a flavored product, and data continues to suggest that flavors play a major role in increasing usage rates among youth. The city of Tempe can and should take a bold move to prioritize children's health by joining the over 270 cities across the country and banning the sale of flavored tobacco products, including menthol cigarettes, and establishing a robust infrastructure for enforcing the ordinance. We urge you to enact the broadest ordinance that will end the sale of all flavored tobacco and e-cigarette products with no exceptions. We also urge you to require that all tobacco retailers obtain a license, which will allow officials to ensure that stores selling tobacco products are complying with the law. Carl Kelly. Local jurisdictions must be alert for and vigorously act against new settings that lure youth socially and include starting nicotine addiction. Please require that all tobacco retailers obtain a license. Licensing also helps stop repeat offenders by allowing the city to suspend or revoke their privilege to sell. Darlene Panny. As a Tempe resident, a retired educator, and grandparent of 6 grandchildren, I'm concerned about the statistics indicating 1 of 6 AZ high school students use e-cigarettes, and 7 out of 10 users cite flavors as the reason they use e-cigarettes. Tempe has an opportunity to act to stem the tide of nicotine addiction. Christy Shane. I have a 16-year-old son. Vaping is rampant at school. Thus far, I've been fortunate that he has not sampled this terrible vice. I advocate for the removal of vapes from store shelves to protect our children. Next commenter is Victoria Stinson. I'm a volunteer with the American Heart Association, a mother of 4, a Chandler resident, and I support the flavored tobacco and tobacco retail license policy. These products are way too accessible to kids. I applaud Tempe for bringing forward this policy. Please support it too. Cynthia Stremba. On behalf of Parents Against Vaping, a national volunteer-led grassroots organization and with full support from our parent advocates in Tempe, I write to officially ask that the Tempe City Council act to protect our children by ending the sale of all flavored tobacco products, including menthol. We also hope this ordinance will require that all tobacco retailers obtain a license. Arizona is one of a handful of states that doesn't require a license, so Tempe must step up and lead the way. Ben Ulan. Hi, my name is Ben Ulan, and I'd like to voice my support against the sale of flavored tobacco products. I've seen firsthand the damage these products can do. They are made to be used as a safer alternative, but in reality, they are just as harmful to your body. Many of my friends have used these products regularly. Now, most have health problems that will haunt them for the rest of their lives. Eric Valdez. There are over 15,000 candy and dessert flavored vapes tempting our kids. The majority of kids start vaping because it tastes good. Vapes are burning the lining of lungs, and young kids are on ventilators or in need of lung transplants. Next commenter is Steve Watson. I am Steve Watson, the Maricopa County School Superintendent. As the elected individual to work with school districts and the youth in Maricopa County, I recognize the negative impact that flavored tobacco products have on our kids. I ask and appreciate that the committee approve an advanced policy limiting the sale of flavored tobacco for e-cigarettes, as they create a huge negative physical and emotional cost for our children. Council members, that is the end of the public comment cards that I have to read. Thank you, and let's proceed with the meeting.
All right, I appreciate that. Thank you very much, Paul, for reading all of those. I appreciate you going through those quickly. But I appreciate the opportunity that our residents and others have to be able to make their comments so that we can hear those. So I really appreciate that everybody has taken the time to write in those cards or show up to the meeting and to be heard. So thank you very much to everybody. All right, the next item on the agenda is the committee sessions item. So we're going to go through current updates and items. So our first presentation is going to be from Assistant Chief Andre Anderson, Human Services Director Naomi Farrell, and Deputy Director Paul Bentley and Jessica Wright. And they were going to be discussing a presentation or having a presentation on encampments in the city of Tempe. So thank you so much and welcome.
Thank you, Councilmember Garland and Councilmember Navarro. This is Paul Bentley, Deputy Human Services Director, and we really appreciate the opportunity to be with you today. With me and all of those individuals that are part of this presentation, Commander Hale from the Tempe Police Department is joining me to be the voice today with this presentation. We are representing the city's Homeless Solutions Task Force. The Homeless Solutions Task Force is comprised of leadership from the City Attorney's Office, City Courts, Human Services, Community Services, the Police Department, Tempe Fire Medical Rescue, Communications and Media Relations, and so significant number of decision makers and leaders throughout the organization meet every week to speak specifically on the topic of homeless solutions and areas that the city can continue to move forward our desire to end homelessness by making it rare, brief, and one time. And so we have a brief presentation to present today, specifically to efforts to address really from the community and from other areas of the city, information business community as well, just a very much an awareness of an increase in encampments within the city and activity of trespassing in intersections. And so from that, and I'm going to share my screen. And just confirming that that screen can be seen, or if not yet.
Not yet.
Okay, thank you. So it looks like I'm hitting the share content and I'm not having that availability. So Paul, can you assist with that?
Hi, yeah, Paul, I can advance the slides. You just need to prompt me.
That would be wonderful. Thank you, sir.
You're
So
welcome.
if we go to the first slide, this is the Homeless Solutions Help Plan would be the first presentation, please. Thank you. And so again, speaking on behalf of the Homeless Solutions Task Force, Commander Hale and I are here to discuss what the plan is, what's intended, how it aligns with our council priorities, the 6 specific strategies that have already been crafted and codified through mayor and council to end homelessness, what the specific goals of the plan, and our tactics towards this plan. And so if we could advance to the next slide, please. So this advancement in what city staff is working on and in partnership with nonprofit agencies and our partners in the community is intended to advance the 3 council priorities of safety in parks, homelessness, and then mental health and well-being. And again, specifically with homelessness, we're talking about ending homelessness by making it rare, brief, and one time. And for those that have not heard of that term to this point, what we're meaning is that we want to reduce the number of individuals that are falling into homelessness on an annual basis by making it rare, brief for those who do fall into homelessness, that the time in which they are homeless is a brief amount of time from when we identify these folks, work with them and assist them into some form of housing, that the timeline for that is shortened again and again. And then one time, that as an individual is able to reach shelter and housing, that there are supportive services available and in place so that they don't recidivate into a form of being unsheltered again, so that it's a solution and not just a process. And so if we could advance to the next slide, please. So within those council priorities, staff, the Homeless Solutions Task Force presented the following 6 strategies to mayor and council a couple of years ago. And these are the guiding principles that we are following with our initiatives, budget requests, staff initiatives, activities. And in brief, based on time today, it's speaking specifically to homeless outreach, ensuring that we have a presence in the streets, in the parks, within the alleys on a consistent basis, doing outreach, again, toward assisting individuals to move out of a unsheltered situation into shelter and housing. Mental health and substance abuse, and the homeless outreach from a city perspective, that's provided by our HOPE outreach team. And we can talk a lot about HOPE, but it's our HOPE outreach team in which they do phenomenal work on a daily basis. There are other nonprofits that we partnered with in that area as well. Mental health and substance abuse response. We know that approximately 25% of our population that is experiencing homelessness has some form of a mental health challenge and or substance use challenge. So a significant percentage of the population. And so we put together specific initiatives to provide support there, not only with those who are experiencing homelessness, but with the community as a whole. And so CARE 7 was supported through funding from mayor and council to create a mental health response team. And that team had the staff has been hired and now trained and now ready to move into the community and to provide their work. And so CARE 7 and that mental health response team is a part of our solution. Park maintenance, making sure that our parks are maintained, vegetation is trimmed, as well as encampments are addressed. And so park maintenance is one of the strategies. The 4th is community and neighborhood engagement, which is ensuring that we have the ability to inform the community of the work that's being done. This is one form of doing that through Councilmember Garland and Navarro's committee, as well as through our communications and media relations group and all of the work that they do to ensure that we are able to not only present information of what's being done, but receive information and act on it as well from the community. And we're going to talk about that a little bit later when we talk about dashboarding. Park security, the idea is to make sure that we have a presence within our parks so that all can come, all can participate, all can utilize our parks in a way that they feel safe. And so a piece of the strategies is to ensure that security is there and there's a contract in place for unarmed individuals providing a security presence in our parks. And then shelter and housing. It's again, this is a comprehensive strategy, comprehensive response in which we want to ensure that there is shelter and housing options so that as we're assisting individuals, there's opportunity to be off the streets. So again, the council priorities is our compass as to how we are putting things together. And these strategies are a way that we follow in order to reach that true north. Next slide, please. So that transitions us into this homeless help plan. Again, emphasis here is being placed on encampments and trespassing within intersections because we are wanting to promote health and safety. And so we do know that from a health and safety perspective, that individuals going in and out of traffic, vehicles stopping at odd times within traffic is a safety hazard. And so we have a desire to make sure that as we're promoting safety within our community, that is one of many areas that we're providing enhanced focus, as well as encampments. And living in an unsheltered situation, it's not a humane, safe, healthy place to be. And so we want to provide an alternative to shelter and housing. So the goals of this plan is that we have continued to first and focused efforts with shelter, services, resources. It's a human services centric approach. Services, shelter, resources are offered first. And so we want to ensure that we're having positive and consistent interactions with folks that are in encampments, providing resources and services and an option for shelter. To ensure that we are also in a positive manner addressing and reducing the quantity of encampments and related impact on public health and safety. That we're collaborating through our city focus, collectively working together to end homelessness, again, by making it rare, brief, and one time. And that also includes working with our faith-based community, nonprofit partners, community advocates, and activists. It's everyone together in promoting that response. And then we have a specific study duration. There isn't a beginning and end to our work, but there is a beginning and end to these enhancements that we're going to talk about so that we can ensure that what we're doing, if it's having a positive impact, that we are gathering data that supports that so we can continue it, as well as if there's things that just aren't moving the needle in the way that we really need them to do as far as advancing our council priorities. And then we're either going to address those or see that, you know what, that didn't quite work the way we had hoped. We're going to put our efforts elsewhere. So there is a study duration so that we can come back with a holistic response of what's been done. Next slide, please. So before Kim and I move into those specific tactics that we have put in place, it's also an understanding for those that may be new to this conversation of where we have come from. And I'm going to do this very briefly, but it's very purposefully, which means that, to ensure that the community knows that this is not something that we're just now starting our work. This work has been done and a lot of effort has been placed in this over years. And some specific highlights to that point. Our homeless outreach team, HOPE, as well as CARE 7, have partnered with our police department, CARE 7 for decades. HOPE specifically having an entity assigned with the police department since 2017 so that there's a co-response to our community. And we have seen significant support and how that is a positive impact on our community. We have an encampment operations team that's been in place since 2017. That encampment operations team meets on a weekly basis to discuss and address encampments within our community, again, from a human services first component. We have an encampment protocol that guides our activities to ensure that we are doing things in a humane, safe, healthy, and promoting humanity in our work and with a specific protocol. That was established in 2017. In 2018, the Homeless Solutions Task Force, which I just spoke about, and all of those partners was created and are meeting. We're meeting twice a month. Now we're meeting weekly to ensure that we're promoting concepts and ideas and responses. In areas that we have focused on in the past have included, one, the development and finalization of the Encampment Protocol, ensuring that we are being very proactive with the encampment operations team, but also COVID and coming up with ways to provide opportunities for testing as well as for individuals to get services based on COVID available to them. Hepatitis A and its pandemic 2 years ago was a place for this. The development of a cooling center for the first time during COVID, the development of a extreme heat center, all of those concepts are flowing through and coming out of this Homeless Solutions Task Force, which allows us to utilize all of the departments proactively to come up with solutions, not just one. Tempe Fire Medical Rescue has a patient advocate services program that is a proactive service to all in our community to provide medical services in response so the folks don't have to use an emergency response for assistance. This includes those who are experiencing homelessness. And then a program known as the Frequent Users of the System Engagement, or FUSE, which is identifying the high users of our emergency system, providing services around them. And I'm going to use the term wraparound, but it's not intended to be just a broad brush statement, but is truly providing services from multiple different disciplines for individuals to assist them in a way that they don't need to use emergency situations for response. Helps assist them in their quality of life and also lower significant costs for the community. And then also the development of the Chief Office of Community Policing in 2021 that Commander Hale is going to speak about in just a minute. So again, this is just to reinforce the fact that while there is much more work to do and we are there to do it, at the same time, it's not something that we are just starting. So next slide, please. So our enhanced response. So what does this look specifically as far as beyond what is being done when it comes to addressing encampments in our community, as well as trespassing in our intersections? And so with that, the first component, and Commander Hale is going to talk about that in about 2 slides, it's more specifically, but is the utilization of community responders and neighborhood ambassadors, which is a new concept that Commander Hale will speak about within the police department that will partner with Human Services, Hope Team, and Care 7 in the work that we are doing. And part of that emphasis will be placed on encampments and encampment response, as well as activity in their intersections. We also, I spoke about the encampment response that we have, the protocol and the work that's done on a weekly basis. COVID and the impact of COVID did significantly impact that work. Labor shortages have been significant in our ability to be able to reach and provide encampment responses as consistently as we were, which was 2 or more times per week. We were reduced to 1 time per week. So we know that there's a correlation between our ability to be in the community and actively responding to encampments through this approach was impacted through COVID. Community Services Director Keith Burke, Deputy Director Craig Hayden, as well as Sean Wagner, huge partners on the task force, but specifically in this work of finding a way to increase our number of encampment and cleanups again. And we are currently at the capacity of being able to provide cleanups 2 per week again. And they are working to make sure that that's sustainable moving forward. Huge lift. In addition to that, we know that in addition to encampments, there are some areas of our city that are overgrown with vegetation. And because of that, there are areas where people may find a safe place in their mind to be that is not within the system of shelter and support and housing. And so we want to, again, promote safety and health within our community. And so we're addressing these areas as we're identifying those, raising up the vegetation, as you may have seen in Papago Park and other areas of the city on a consistent basis. That's part of the encampment work. Next slide, please. Huge piece of what we're trying to do here is to communicate what's being done. And so we have, as a system, been using tools to help track things and process flow things. We're talking about Excel spreadsheets. We're talking about paper documents. We're talking about a significant amount of effort being done to just ensure that we're not missing something. And so in partnership with our IT department, Dr. Stephanie Dietrich and her team, they have been working with us hand in hand to create some tools that will promote our effectiveness and efficiencies in multiple areas. There are 4 main lifts. The first of them is that our Hope Outreach team have been using Excel spreadsheets to track their work and their efforts. And so with IT and Stephanie and her team, They have created and implemented an application that is now available on their phones so that when they're doing engagements, not only are they getting the information to the person in need, they are also tracking that information, getting geolocating that location so that we can track where and when we have been in certain locations, so that we have a much better ability now, not only of tracking the number of engagements, but how those engagements have turned into case management, into shelter, into housing, much more effectively than we've ever been. And so Jessica Wright, as the manager over the Homeless Solutions Group, and her team have been using that tool, and we have been seeing some significant positivity towards being able to report and showcase what work is being done. In addition to that, so that is in place. The second huge piece of this was encampment and encampment reporting. In the near future, the community will have the ability to go into 311 or other areas to report for themselves an encampment response. If you can go back one slide, please, Paul. So in that, I will move. Looking at the time, I will move. So in that, I appreciate the nudge, Paul. So with that, the streamlined approach is that we currently have an application in place in which every type of form of communication coming out of encampments is being funneled into Hope, and we're tracking it, and we're reporting it, and we're triaging it. That tool in the near future will become forward-facing for the community to use as well. Huge lift, and it's in place, and been tested and tried and true and in place now. Third component is then the actual being able to report on encampments themselves. Where are they located? What priority are they? What type of services being offered? All of that information is being placed into an encampment tracker component. It's gone from development into testing this week. And so we are going to be more clear in our ability to communicate the efforts specific to encampments and encampment cleanups in the very near future. And then in that, our police department has submitted a process that Kim may touch on more, but is in regards to tracking their work as well, that IT is providing some support on in a very, very positive way. So thank you for those efforts, Stephanie, and your team. So again, those tools, while it's one is to look at them as a way to better communicate, it's also much more efficient and effective as staff to use those tools in the work that we're doing to be even more effective. And we believe that's going to happen. Communication and education is a huge component of this, and working with our community relations folks to do that, we are. And then also utilizing the Homeless Solutions Task Force that meets on a weekly basis to ensure that there's an accountability of action and that we're following through on what we're saying we're going to do and doing it. And so that's all a part of this plan. So Commander Hale, the pieces specific to the PD are next. Paul, could you please advance the slide?
Thank you, Paul. Everybody can hear you okay? All right. I'm going to try to make up a little time here.
Sorry, Kim, I'm sorry.
No, I'm just teasing you.
You guys are doing great. Thank you so much.
Right. So when when this was brought to us, we had, as Paul described, had I guess a pilot program in 2017 where we collaborated with Hope in trying to devise a way to help with encampment cleanups. From that 2017 approach, we found a lot of success in offering services, getting people housed, as well as getting them off the streets and into different locations. You know, and I appreciate, I think some folks were posting some articles about housing was not the right approach. It exacerbates the problems. But in some of those articles, if you read them, there's no strings attached to those kind of housing options. And this was researched, and we're finding actually a lot of success where Hope not only finds the housing, but they're following up with services. And it's a very much an individualized cater approach. And Hope and Paul can go into all the different services they offer. But we realize that each person has, whether it might be seriously mentally ill, there might be a substance abuse, whatever those issues are, they're trying to be addressed along the way, so that this is an issue that they can address on an individual basis, as well as there are some strings attached that they have to obey when they're in the housing program. So, and that's out of the police hands. We're there to play our role. So using that model that we started in 2017, we expanded that across the city. And when Chief Glover came on board in 2021, he created the Chief's Office of Community Policing. And it's through that arm right now that we're operating and partnering with Hope and all the different departments to try to improve the situation and provide the services in Tempe to those who are experiencing homelessness. So that's the general plan right now. And so as we're expanding that, we're right now addressing anywhere from 8 to 12 encampments per week. Of those, anywhere from 5 to 6 on average are being resolved, and folks are being placed in some of the temporary housing and receiving services along the way. So those that are service resistant, we know that it takes numerous touches to reach individuals depending on what their concerns are. Just in a meeting the other day, there was an individual that was experiencing homelessness for many years. And he said once he was trespassed out of a particular area, that was this kind of the straw that broke the camel's back. And he said, okay, I need to get off the street. He accepted some homeless solutions for himself that worked for him. And now he's tied into meetings with us and willing and desiring to help us reach other people. So there is success that we're seeing, and so we're hoping that we can continue to learn from individuals like this what it is that we can do to help improve our services and continue to improve the conditions in Tempe for everyone. One of those things that Chief Glover had envisioned was neighborhood ambassadors. And neighborhood ambassadors are they often called unbadged, unsworn positions where they're going to be taught in the CPTED principles, that's crime prevention through environmental design, community and conflict resolution. They're going to be assisting and partnering with HOPE in outreaching to those experiencing homelessness, proactive response generally to quality of life issues, substance abuse, code enforcement, animal complaints, nuisance in parks, those kinds of things to assist where there's gaps in any of our services. So that we're excited to bring those neighborhood ambassadors on. We're hoping to start making some of our first hirings coming up here soon, and bringing those onto the team. Those are much like kind of we talked about the community responders. Community responders' primary role is they're taking a lot of the lower priority calls that there's no suspects on the scene, traffic collisions, some other burglaries that happened when they come back from vacation, things like that, where our officers now are freed up to respond to other calls for service and improve our service generally to the community. Another thing, an idea that came up was a community outreach center. That's being constructed or put together right now up in the what we call Beat 11, which is up off of Scottsdale Road. In that, we're going to have a storefront office along with HOPE, where we can then have our officers go in, provide some presence not only to that area, but also collaborate with HOPE and help to continue to provide some additional services to the North Tempe community. Training, we're doing some enhanced training for our officers. Some of that includes some of the ways and the restrictions that we have when we're dealing with individuals experiencing homelessness, to make sure that we're doing all the right things. We did some training in consensual stops and non-consensual stops, training on the Fourth Amendment. There's some enforcement protocols that we've developed. We're still processing or developing some protocols when it comes to property and property storage to make sure that we're doing all the right things there, and working close with our attorneys to make sure that that we're following all the case law and doing really what's best for not only for the community, but to help improve and I guess the chances and opportunities for those that are experiencing homelessness to accept those services and to improve their own lives. Last but not least, when was the media and the community outreach, and that is something that we continue to do both with the city public information officer as well as our own public information officer, as we collaborate with these different encampments and approaches to make sure that the community has there's a transparency to it, that they can see what we're doing, can ask questions, and that everybody can track the progress of how we continue on. And that's it for me.
Next slide, please, Paul. Councilmember Garland and Navarro, we are here and available for any questions, comments you may have.
So I just want to say thank you so much for coming and giving us an update. I think, a lot of people in the community have noticed those encampments, and at least for me, since I drive from one end of the city to the other end of the city, I've noticed that those encampments have gone away, at least in some of the areas that I'm driving in. So I really appreciate that the multi-departmental work that we're doing to serve our community and serve the people who are unsheltered in our community. It's that it's that hard work and compassionate care that we do for every member of the city that is really important. And I thank you so much for your work. I love how we say rare, brief, and one time. That's one of my favorite things that you guys do. I think the neighborhood ambassadors is an incredible program, and I really can't wait for that to get started. And I love the community outreach center that we're going to have in the northern part of Tempe. I think that's a really great thing. And I'm really looking forward to that and to have that associated with the Hope team in there also. So I think you guys have been doing a great job, and really, really appreciate you guys coming in and taking the time to come to meet with us today. Joel, do you have any comments?
Yeah, just real briefly, really, you guys, amazing work. I mean, when you guys put together and do this presentation, it really kind of just echoes all the things that we're doing in Tempe. It's beyond me. I mean, we are trying to hit every angle we can, and I think you guys said it all with all the services that we're trying to provide to make sure that, you know, we can tackle all these different issues in various different ways. And it just shows a lot of the time and energy you guys have been putting in this, and the city has been putting into this issue. But with that said, you know, obviously we don't want this, you know, to be the one-stop shop for public safety to handle. We have other resources. So we're not using our police officers or even our firefighters on things that we really need them to be used for, you know, like fighting crime and fire and whatnot and things like that. But having the right services for the right people, I think it shows that we're trying to do our due diligence in so many different ways. And I think it's the new era that we're trying to achieve when we talk about how do we rethink our approach to helping helping health crises out so they don't escalate into a bigger incident down the road. So I just want to tell you guys I appreciate it and thank you so much.
Thank you.
Thank you.
I completely agree with what Councilmember Navarro said. One quick thing is, how is it best for a resident to contact your department to be able to talk about if they see an encampment? What's the best way for them to notify you of that?
Thank you, Councilmember Garland. For today, if someone wanted to do that today, the best way to do that is to go to an email address of hope@tempe.gov, HOPE@tempe.gov. That system has been in place for a while, and it is actively reviewed by staff on a consistent basis and responded to on a consistent basis. And so today, that is the best way to get directly connected to Hope. In the future, we are also going to be adding a specific tool on the 311 website and other areas that can connect folks who want to specifically communicate and report on an encampment. And so that's coming, but right now today, hope@tempe.gov. And at the same time, in addition to being able to be public facing on the reporting encampments, we're going to make sure that we're very public facing on the resources that are available to those who are experiencing homeless, for those who are wanting to help connect folks to those services as well.
Okay, great. Thank you so much. Yeah, I was wondering about today because in your presentation, you said the 311 is coming. So wanted to know what to do between now and then. So thank you so much, Paul. That was wonderful. So we're going to move on then to the item number A2. It's presentation on the homeless dashboard. And again, Paul and Commander Hale, that is in your hands.
Thank you. Paul, if you could open the next slide, please. And we're going to stay on this slide. And so as part of the work that we just went through, Commander Hale and myself on behalf of the Homeless Solutions Task Force, is a component of being able to communicate this information to the public on a consistent basis that's informative and useful and helpful. And so dashboarding is a part of our culture within the city of Tempe. And so in working with our, again, Stephanie Dietrich, Dr. Dietrich, and the IT department, Human Services, Police Department, and all our departments, we are currently in the process of taking the data that we're gathering and finding an appropriate way to put that into a dashboard that will be public facing to the community. That's coming. I don't have a specific time yet, but in that alignment of those IT applications that are either up and running or under development, towards the end of that is then going to make sure that we can then put this into dashboards both for employees and for the community. And so that will be coming in the future.
All right, I appreciate that because that does give us an idea that, you know, that information is coming that our public is going to be able to see. So thank you so much, because it's one thing for us to talk about it here at the meeting, but what do we have online? 27, 30 something people that are here, and that's not, you know, a large part of our community. So it's going to be great that we're going to be able to share that information, and I can't wait for you to come back to our committee and we can share what that dashboard is going to look like. So I'm really looking forward to that, because I think, again, a part of the transparency that's so important to us at the City of Tempe is sharing this information on the dashboard. So thank you so much. Joel, do you have any questions?
Oh, you're good. Thank you.
All right. Well, Paul and Commander Hale, thank you so much for being a part of our meeting today. We appreciate your work.
Thank
Thank
you.
you.
All right, thank you so much. So before we go on to item 3A, we got some information that some people were having a hard time getting logging on to our committee meeting, people who had registered to speak. And just for clarification, you need to fill out a comment card 2 hours in advance of our meeting. And if we did not receive that, then we can't get you an opportunity to speak at our meeting, but we are more than happy to continue to take your comment card and add it as part of our record for our meeting. So Paul, I was wondering if you could look through that list of people who had been registered for us to let speak, and if they are online, if you would be able to call on them, please.
Yes, certainly, council member. Let me start with Joanna Strother. And Joanna, can you hold on for 1 second? I'm bringing up my participants list. I want to make sure that you're still joined with us. And so either Joanna is not on the call. Oh, here we go. Joanna, you are, and I'm going to unmute you. Thanks so much for your patience.
So Joanna, go ahead.
Can you hear me?
Yep, we can hear you now.
Okay. My name is Joanna Strother, and I serve as the Senior Director of Advocacy for the American Lung Association. Next Tuesday is May 31st, World No Tobacco Day, and this is an annual observance. And right now we have one of the most opportunities to date to make a real difference to save lives and especially protect our youth. Tempe is a leader when it comes to tobacco control and was one of the earliest communities to prohibit smoking in restaurants, and doing so before the statewide law went into effect. Tempe can again be a leader in this critical cause, becoming the first city in Arizona to end the sale of flavored tobacco products, as over 300 cities across the country have done. It's also important to include adequate enforcement when considering this policy. So today I urge you to protect our youth and support ending the sale of all flavored tobacco products in Tempe. And thank you for allowing me to give my comments today.
Thank you, Joanna.
Council members, we're also joined by Stephanie Seaty. I'm sorry if I'm mispronouncing your last name. I'm going to go ahead and unmute you for your comments.
Thank you. It's Stephanie Siete. I am a Tempe Coalition member. I represent PAVE, Parents Against Vaping and E-Cigarettes, Tobacco-Free Kids. And I've worked in the East Valley for the last 20 years protecting kids by doing drug education programs at community bridges. And I say that because one of the biggest drugs that we see as an addictive drug is nicotine. We always tell people the two hardest drugs to stop using are nicotine and heroin. And we know that historically, illegal or legal, anything that's that's appealing to kids, they're going to get their hands on. That's one thing that's a little bit frustrating, seeing all the flavored tobacco with the 15,000 flavors of rainbows and unicorns and mangoes and chocolate. Historically speaking, that has failed to make it about an age or making it illegal. We need to remove products from store shelves that are appealing to kids, especially products that are physically addicting, that are getting in the hands of 10-year-old kids. I just think it'd be great for Tempe to be a leader in Arizona, to stand up, not worry about the money, protect the youth. 7 out of 10 kids start using vapes because it tastes good. 1 in 6 Arizona high school kids are using this stuff. And we all know the marketing tactics behind big tobacco. No one likes the word lure when it comes to children, and our kids are being lured by this sweet, attractive flavors. So at a time where kids are more stressed out and coming up with excuses, to deal with that stress by using, let's remove the temptation. And I applaud Tempe for making this a priority. And I'm honored to be a part of all of those agencies that want to protect kids. And I hope you guys support our efforts. Thank you.
Thank you, Stephanie.
And next up, council members, we have Larry Tracy. Thank you so much, Larry, and I appreciate your patience. I'm going to unmute you now for comment. Hey, Larry, are you still with us? All right, council members, I don't believe that Larry's on, so I will go ahead and put him back on mute. And that is all of the requests to comment that we've gotten within the deadline, council members. Thank you.
All right, thank you so much. So we will go ahead and move on to our item A3 for the presentation on limiting the sale of flavored tobacco for e-cigarettes. So we will have Assistant City Attorney Elizabeth Higgins and Tax and License Supervisor Jess Raskin. So welcome, Rankin, sorry. It's all yours, Elizabeth.
Thank you, Councilmember Garland. I will try to make this quick. So if you want to start the slide deck. There we go. So my name is Elizabeth Higgins. I'm with the City Attorney's Office. We can just start going through this slide deck. You can go to the next. Yes, so this is the council priorities here that have been approved by council. These were shared with you on the last time that this was discussed in February. Just a little reminder about these two council priorities. Next slide. Little bit on the background. So this first discussed in last October and then a November work study in February. On the 25th, you guys was the last time you had a discussion on on the idea of moving forward with an ordinance to ban flavored tobacco. And since that time, I've been working to see how other cities have addressed this issue and also reviewed some of the litigation and case law that comes along with this sometimes when cities go ahead and regulate in this area, just so that we could be fully aware of what consequences may or may not come as we move forward. Next slide. So this is the federal statutes behind the regulation of tobacco. The most recent act was this Family Smoking Prevention and Tobacco Control Act, which granted the FDA the authority to regulate tobacco. In 2019, there was also some Tobacco 21 legislation that actually raised the age of sale in the United States to age 21. Next slide. I'm going to make up all the time that Paul and Kim used to. For some Arizona municipalities have regulated in this area, they have raised their minimum age to 21 to conform with the federal law. There were several legislative bills this session that also looked at doing largely the same thing. To my knowledge, maybe one is still being discussed, but it doesn't look like at this point, since they're focusing on the budget, they're going to be moving forward with those types of legislation this session. Phoenix, as you can see, did discuss a ban on the flavored tobacco products back in 2021, but it did not move forward at that time. Next slide. So this is our current provisions in the city of Tempe. We have a designation for a tobacco retailer who is a person or business that primarily sells tobacco products or tobacco paraphernalia. So these are your vape shops that you would see. In Tempe, we have separation requirements for these tobacco retailers, so they cannot be located within 1,320 feet of a charter, private, or public school. Next slide. So we've got some opportunities for us to move forward in this area. So the next few slides discuss what a possible ordinance could look like. So looking at establishing a tobacco license for those folks that do sell tobacco as part of their retail establishment. Some policy considerations here that we would also be looking at is enforcement, how that would take place, who would need a license, the kind of education that may be
provided from retailers to their employees, and then, just how to best keep young people from accessing tobacco, because that is the main concern here, right? It's that tobacco is being a whole new generation is being exposed to tobacco, and mostly through this flavored tobacco that is arguably marketed toward them with these types of flavors that are out there right now. Next slide. So this just kind of outlines what a new ordinance could do. So it could establish a tobacco license. Jess is here because it would likely be placed within his realm, which is the tax and license division. And the police chief and the police department could be called on to render assistance in the enforcement of that license as required. Because we are looking at trying to keep these types of products out of the hands of our young adults, raising the minimum age to 21 to conform to federal law would also be appropriate as part of this legislation at this time. Next slide. Looking at the administration of the license, Jess and his folks, they would be responsible for the administration. So putting together what the application looked like, putting together what a fee would be to cover the cost of that administration, having a license for each retail business where tobacco is sold, how we would notify those folks, possibly an annual renewal process so that we are annually reminding these folks that there could be two things. There would be a ban on the flavored vape, and that the age of sale would be 21. And then just how the general license would be enforced and how those provisions would be enforced. Next slide. So yes, here, unlawful activities as defined in the new ordinance could include operating a business that sells tobacco without a valid license, selling to a person under age 21, selling the flavored vape, which is the main topic of this conversation, and continuing to sell tobacco if you had your license revoked. Next slide. And then penalties here. So obviously fines would be a penalty that the city could impose, and that we have had imposed numerous times for other types of license violations. We could also look at prohibiting the sale of tobacco during a period of time if maybe it's a second or third offense, and we could also look at the revocation of the license by tax and license. Next slide. And this would just be next step. So we could come back to you at your next meeting with a more finalized draft ordinance that could be taken through public input and stakeholder input. And then, as you guys know, then the consideration would come back to a work study to get the full council on board with moving forward. And then any type of formal ordinance would go on a regular council agenda. And any questions?
Thank you for your makeup of time there.
Doreen,
Go ahead.
Doreen, I have two people have been trying to get on desperately on this call, and if I can call on, I'll go with Joe Uhas first. If we can get him in on the call, I know you had something to say, and I know Trish Hart was out there trying to also get in on that. Can we possibly, if Joe can get on, can we let him on?
Okay, I think Joe had a comment card. We tried to call on him earlier, but the other person I don't see had a comment card, and so we can't call on them.
Okay.
Unless they had one turned in 2 hours in advance.
Council members, we are aware of some technical difficulty that some people are having in terms of logging on. As best as we can, we're going to try to address that.
Okay.
Okay,
Thank you.
so Paul, will you just let us know when ready, and we'll continue on?
Yes, council member. And you said that the individual that was having problems getting on, what was their name?
Trish Hart, Joe Uhas.
Okay.
Thanks.
Thank you. I was going to ask you, Elizabeth, so what we're going to do is, because we've got this information, you've done the research, and I appreciate so much that you've gone through to do all this work that we've asked you from our work study session. So what we would look at moving forward would be you coming up with the ordinance, coming up with what one could look like, and then you would bring it back to this meeting for discussion, and then the decision to whether we move this forward to a work study session for the council.
Yes, I could bring it back at the next meeting, which I think you're meeting in June.
Yep.
Yes, so I mean, I could have it ready for the June meeting. And then you could take it through any public process that is required by the rules of procedure. And then once you guys were able to advance it back to the work study for council, council could have their input, and then we could finalize the whole thing for its consideration on a regular council meeting agenda, which an ordinance would take 2 votes.
Okay. All right. I appreciate that. Joel, do you have any questions while we're still trying to see if we can get other people on?
Yeah, and I think you said it, but just to clarify, 21 is what the age we want to get it to, and that kind of follows with federal and some state laws. Am I correct on that, Elizabeth?
Yes, for federal law, yes, and then some states have also increased their age, and our legislature was looking at that, but it didn't advance to my knowledge in this legislative session.
Okay, I was wondering because I thought I was hearing word that either HB 2505 might be able to raise that.
Yeah, I think that bill might be the only one that's still around, but they're also focusing on the budget. So I think largely a lot of the bill work has stopped until they finish the budget at the legislature. And then sometimes with that, they move forward with a sine die pretty quickly. So definitely something I've been keeping an eye on. And I can double check that it's still alive and still possibly moving forward.
Got it. Appreciate that. Thank you. I guess, Doreen, where are we at on our technical difficulty?
Yep. Paul, were you able to see if we had Joseph Uhas in the queue at all? If you see him? I know there were a couple other people that were trying to get on also and haven't been able to do it yet.
Unfortunately, council member, no, but I do have somebody who is on that hasn't been able to speak, and that is Trish Hart. So Trish, I'm going to unmute you so you can make comment at this time.
Council members, thank you. For the record, my name is Trish Hart, and I'm here today on behalf of the Arizona Food Marketing Alliance, which represents retail grocers and convenience stores throughout the state. And we are opposed to a citywide flavor ban. We believe currently the federal FDA is regulating federal flavors at the federal level. We strongly support a statewide regulation of tobacco and vapor products at the statewide level, and believe that that is the best way to ensure that these products are not in the hands of youth. And so we welcome the opportunity to discuss this further with the council members. But as responsible retailers, we take the responsibility of selling these products very seriously. We train our employees, and we do everything we possibly can to ensure that these products do not get into the hands of children. And we will continue to make sure that we do everything we possibly can to do that. And we strongly support raising the age to 21 at the state level, and have been working with the state legislature on House Bill 2505 on that legislation as well. So thank you for your time. Just wanted to also let you guys know that Haley Hodges and also Mark Miller were also signed in and had registered and received confirmations back, but are not showing up on the as I'm requesting to speak.
All right, I appreciate Trish. Thank you for the time that you have given us to talk, and sorry about us being late. We are trying to work through our glitches. If Mark and Haley have registered and but we don't have them on there, what we'll do is hopefully we can get them to fill out a comment card that we can make part of our record for our meeting.
Doreen?
Yes.
I think Joe Uhas is one of the attendees, I believe. And I think it's under Joseph Uhas. Can we try see if that, Paul,
Yeah,
can we
let's
find that?
see.
Yeah, yes, council member. And again, apologies and thanks for everyone's patience while we work through some of these technical difficulties. Yes, Joe, I'm going to unmute you in a moment and you'll be able to speak then. 1 second. Joe, you should be unmuted.
Well, thank you very much, Councilwoman. Thank you so much, Councilman. Thank you. And we certainly understand in these difficult times the problems that arise on a technical nature. Look, no harm, no done, no foul, no harm. This has happened to everyone who's wanted to participate today, and I would encourage you, even with these technical problems, to move ahead with the measure that is before you. I won't be repetitious about the adverse effects of these instruments of disease and premature death that are disguised as kid-friendly products. Rather, I want to speak to you directly this afternoon as City of Tempe leaders who've had this issue brought before you and your colleagues back in October. So what's changed in Tempe since then? Well, here's what's changed. First of all, we went through another school year. And because 1 in 6 Arizona high school students use e-cigarettes, it's safe to say that several hundred more Tempe high school students have embraced the regular use of flavored e-cigarettes. Since then, more Tempe students have also chose to join the ranks of the growing number of their peers in smoking other combustible tobacco products. And this is a very important point because that involves flavored cigars and, of course, the tried and true minty menthol cigarettes, because there are now 250 flavored cigars on the market that target kids with such schemes as 2 for 99 cents in order to get them hooked. Now, since last fall, we also went through another session of the Arizona legislature. And as you all know, the Arizona legislature is a place where good ideas go to die. While opponents of the action we are urging you to take will say this is an issue best addressed on a statewide basis, their proposed solution includes preempting the city of Tempe and other communities in Arizona from taking on this critical issue and criminalizing the kids that market these products for using them. Think about it, criminalizing to kids. That's right, because the bill written by Big Tobacco and sponsored by those who shill for the industry at the Capitol include provisions to penalize not the retailers who sell the kids these products, but the kids who use them with criminal records that could keep them out of college or getting a job. So what's happened since this issue came to you nearly 9 months ago? Not much, unless you count on the fact that hundreds of Tempe kids are now on the path to a lifetime of nicotine addiction. This is an extraordinary opportunity for Tempe and a legacy opportunity for you, one similar to the actions your predecessors took 15 years ago when the Tempe City Council was one of the first cities in Arizona to enact a smoking ban in public places that other cities followed before the voters adopted a statewide no smoking initiative. This is your legacy moment. Seize it. Seize it and advance to the full council an ordinance that ends the sale of all flavored tobacco products and e-cigarettes with no exceptions, and that includes menthol cigarettes. Yes, create the retail licensing program again, because the state has failed to do that so that this ordinance can be truly enforced. Seize this moment and seize it to include menthol products. The presentation that was made today seemed to be silent on that. But what you need to know is nearly 50% of youth between the ages of 12 and 17 who smoke traditional cigarettes use menthol products. 65% say they would quit if menthol cigarettes were banned. And nearly 60% of high school students who use e-cigarettes use mint and menthol flavored products. So do not, in the ordinance that comes before you, exclude the fact that we can attack this problem in its entirety by including menthol tobacco products as well. Because if you don't, you're going to force kids who now are using these flavored e-cigarette products to instead find the remaining channel for their nicotine addiction, which is menthol cigarette products. Thank you very much.
Thank you, Joseph. I appreciate again you taking the time to be patient with us while we're trying to work through our issues here. Paul, do we have anybody else that you have? I see that there's a Sharon Doyle that's supposed to be online right now. Is she there?
Councilmember, I do not see Sharon Doyle on my list of attendees. I'm going to check one more time. No, I do not see her.
Okay. All right. Looks like Larry Tracy that we called on earlier is typing into the chat that he is there. I don't know how to recognize him. Okay, so I'm not sure how to recognize people. If you don't see any other ones on there, Paul, we'll just keep moving on.
Oh, I'm sorry. We have Mark Miller, and Mark, you are unmuted and you are allowed to make comment.
Thank you very much, City Council members. Can you hear me?
Yes, we can.
Thank you for your time. Again, I'm at the Arizona Food Market Alliance. We represent about 1,200 different, mostly chain accounts across the valley, including grocery stores and convenience stores. Just like 4 points, there's been some good ones, and this is a big issue, but tobacco is legal, and we want to do it correctly. All of our retailers did move the age up to 21 without a state ordinance. We did honor the federal level. There has been some good numbers that have come out, and I'm hoping that Ms. Higgins can look into a couple things for us on her presentation. We've seen that the age from when it peaked in 2019, and then when President Trump initiated the 21, we haven't seen continually decrease over those last couple years, and it's projected to be down about to 11 or 12% this year. That people under 21 in high school have tried tobacco products. So it looks like the 21 did make a difference, and that was information from the FDA and the CDC. Online too, at the FDA, in the city of Tempe, they did 35 stings, and 33 passed that they did not sell to underage people. So 33 out of 35. The 2 that did sell to minors were independent, small little liquor stores and another individual, but not the chain store. So our training is working. We do believe that the federal government will eliminate all the flavors this year. Again, you know, we still think that menthol's been around for a long time, and that might get some resistance. And then the final point, I'm hoping again that Ms. Higgins can look into, that she had, I believe it was 4 cities that have initiated age 21. They did licensing, they did fines, but our retailers are telling us that Flagstaff and Tucson particularly have not initiated any licensing at this point. That no cities have been able to enforce the laws with their police force. They haven't set up any people to help with the new laws, because I think that Councilman Navarro said it well, that your police departments are really stressed. They have a hard time replacing when someone leaves. The training takes a long time. So again, a city ordinance is a good effort, and it is the right as we go forward. But I do, ask you to do a little bit more digging into the ones that are currently in place, and to see if they've been able to initiate. The state has the resources. They have the officers that are sworn, that are not focused on other types of activities, that could do a good job of enforcing whatever laws are in place at the state level. Again, we do our best, and I think we do a really good job of ensuring that no one under 21 purchases any nicotine or alcohol products for that matter too. So thank you for your time. I think this is an important issue, but an important issue needs national and state solutions, and it's more difficult at the city level to make that happen. Thank you for your time, and thank you for your support of Tempe.
Thank you, Mark. I appreciate that. Paul, do you have anyone else?
Yes, I do, Council Member. I have Haley Hodges, and Haley, I'm going to be unmuting you. And again, thanks for your patience.
Thank you so much, council members. My name is Haley Hodges, and I represent the National Association of Tobacco Outlets, which does have several member retail stores in Tempe. An ordinance prohibiting the sale of all flavored tobacco products is not necessary due to the actions being taken by the U.S. Food and Drug Administration. Manufacturers of new tobacco products, primarily electronic cigarettes and nicotine vapor products, were required to file what is called a pre-market application with the FDA by September 9th of 2020 in order to keep their products on the market until the agency issued either an order denying the application or authorizing the continued sale of the product. Since September 2021, the FDA has denied applications for a total of 7,729,309 e-cig and nicotine vapor products. So far, the FDA has issued orders denying the sale of every flavor of vapor products, including candy flavors. The FDA continues to conduct its review of remaining pre-market applications and has stated that it intends to complete its review by June of 2023. So this means that all flavors of electronic cigarettes and vapor products that may be appealing to youth are being removed from the market. Moreover, in April of this year, the FDA issued 2 proposed regulations banning the sale of menthol cigarettes and flavored cigars. And if enacted, these regulations would apply nationwide. All of these FDA actions demonstrate that the issue of flavored tobacco products is being addressed at the federal level, and Tempe should allow the FDA regulatory process to continue to respond and address the issue of flavored tobacco products. And one more piece of information that I wanted to bring to light to these council members is that survey data published from joint research by the FDA and CDC called the 2020 National Youth Tobacco Survey showed that 1.8 million fewer US youth were using e-cigarettes in the year 2020 compared to the year 2019. So there is a decline in youth tobacco rate, and the FDA has stated that they are encouraged by the overall declining rates. Our youth understands the risk of tobacco, and less of them are using it each year. Thank you for the opportunity to speak on this issue today.
Thank you, Haley. And it looks like we don't have any other. We are out of comment cards and the people that are available to speak right now. So everybody, thank you so much for your patience in getting through all of these. It's an important topic, and there are a lot of people who want to make sure their voices are heard, and we want to make sure that they are heard. So thank you very much. Councilmember Navarro, do you have any other questions? Hearing none. Elizabeth? Oh, okay, thank you. Elizabeth and Jess, thank you so much for taking your time to do this presentation. And I look forward to what our next steps will be with this issue. So thank you so much. All right, we are going to go ahead and move on to item B. 1. It's just to mention that our next council meeting will be on Friday, June 24th at noon. We don't have specific topics listed on our agenda, but I would like to mention, and if this is okay with Councilmember Navarro, is we had talked a few months ago about Vision Zero, and there was a discussion with staff about having some type of data on our website that was going to be able to put up the Vision Zero action plan and the 37 transportation safety strategies, and then have some type of living document on there that shows which ones we've already done, what are we doing now, and what's coming up. I looked on the city's website today and I did not see that, but I would really like to see where we are in that. So that's one presentation that I'd like to see, but I don't have any other one at this moment. Joel, do you have anything?
No, I think we're good. No, I appreciate you taking the lead on this today. We tackled it. We got through it.
We got through it, yeah, but you're sitting in gorgeous green area and I'm not, so I don't know about that.
It's only 67 degrees.
Oh gosh. Oh, Joel. Well, thank you, Joel, for being here. I'm so jealous right now. Okay, so our next council meeting will be Friday, June 24th at noon. Thank you so much, everybody, for your participation. Thank you so much for staff for helping us through this our committee meeting, and we look forward to seeing all of you and having you participate at our next meeting in June. So thank you very much. We'll call this to an end. Joel, you good with adjourning?
Thank you, council members.
Thank you.